Hello everybody, the topic for now is antibacterial susceptibility tests and how we do the procedure for antibacterial susceptibility testing. So under this heading, we will be discussing about definition of antibiotic susceptibility testing, what is the need or requirement for doing this testing, what are the different types of ABST available, the diffusion methods, the dilution methods, as well as the automated methods which are available in antibiotic sensitivity testing as of now. And just before going on to it, just a little introduction about bacterial infections. We all know that they commonly cause a lot of infections in this world, and they cause a lot of morbidity, which means suffering, and mortality, because some infections can even be fatal. And now that we know that antibiotics are our only choice for combating these bacterial infections, and they are very important now, but these antibiotics are very much overprescribed in our country, and so this leads to a lot of problems like drug resistance. And what is an ideal antibiotic that you have to give for a patient to treat an infection, a bacterial infection, is one which has a selective toxicity. That means it is harmful only to the pathogenic bacteria, but it's not causing any harm to the host. So that we have to be sure how we select the ideal antibiotic. So selection of the antibiotic depends upon the certain factors like one, the site of infection, meaning where the person is having the infection. Like for example, if it is a urinary tract infection, an antibiotic known as nitrofurantoin is used, which cannot be used for various other sites. The age of the patient, like for small children, we do not give tetracyclines. Other illnesses which are present, for example, when the renal function is compromised, we have to be very careful using a group of antibiotics known as aminoglycosides. Then the place from which the infection is acquired, whether it is from the community or whether it is from the hospital. Why this is important is that hospital acquired infections are usually very much drug resistant pathogens will be involved. They are known as multi-drug resistant organism or MDRO. So for that, we have to be more using higher antibiotics when we use this. When we come to this hospital acquired infections. And then certain other mechanical predisposing factors, like when the person is having some catheter in place, an IV cannula, so that also plays an important role in selecting the antibiotic. What happens when you indiscriminately use antibiotics? One, your patient can get sensitized. What is the meaning of that? Is you may develop an allergic reaction to your antibiotics. The normal flora in the intestine can get altered. So there's a change in your gut flora that can lead to various other complications, can mask serious infections. For example, a person with a respiratory tract infection of about 2 weeks duration, we might think it is just a simple bacterial infection. We might give antibiotics to treat that infection, but it may be tuberculosis, which needs a totally different set of antibiotics. If you indiscriminately use antibiotics, it may lead to drug toxicity. And then it can also lead to the development of drug resistant strains which are developing due to this selection pressure. And antimicrobial chemoprophylaxis is another thing where you give antibiotics to prevent certain infections. So this can be done in 3 types of conditions. So one is a person who is normal, okay, now person with normal immune system, but they are exposed to specific pathogens which are dangerous pathogens. So we give a prophylaxis. For example, in the case of people exposed to meningococcus, which causes meningitis. You give antibiotic prophylaxis in people where they are having an increased susceptibility to infection. Like for example, they may be immunocompromised. So you give them antibiotics to prevent them from getting an infection. And of course, antibiotic prophylaxis in surgery. So usually we give antibiotics prior to surgery so that we see that the person does not develop any infections after the surgical procedure. So now coming on to exactly what is antimicrobial susceptibility testing. So these are tests which are performed on bacteria, which are isolated from the clinical specimens or samples of patients. And these tests will help us to determine whether the bacteria which is isolated is sensitive or resistant to a particular antibiotic, meaning whether we can use this antibiotic to treat him or her or not. So that is the purpose of doing the antibacterial susceptibility testing. And why should we do the testing? Because we know that some bacteria can go for resistance, drug resistance. For example, especially this is more common among gram-negative bacteria than gram-positive bacteria. But gram-positive bacteria also are quite developing drug resistance. Then potentially fatal infections, you have to use specific drugs to treat it, for example septicemia and meningitis, and you have to give the treatment after doing the sensitivity testing only. Even if you start another antibiotic, based on the sensitivity report which will come after 48 hours, you will have to change the antibiotics. And whenever you are going to use selectively bactericidal drugs like those used to treat infective endocarditis, again you need to do sensitivity testing. And in case of cultures where you get only normal flora being isolated, normal flora are those which are present in our respiratory tract or GIT, which are always present there and which do not cause any disease. So when you isolate normal flora, you do not do antibiotic sensitivity testing. So these are the indications for antibacterial susceptibility testing.